Trăim un paradox interesant. Sunt mai multe cazuri de cancer diagnosticate anual, dar numărul deceselor din această cauză este în scădere. Acest lucru se datorează progreselor uriașe în diagnostic și tratament, precum și colaborării tot mai strânse dintre disciplinele medicale. Austria este printre liderii mondiali în cercetarea oncologică și în rata de supraviețuire a pacienților, tocmai pentru că oferă bolnavilor acces rapid la cele mai moderne tehnologii și la o întreagă rețea de specialiști cu renume.
My name is Dr. Johannes Drach. I'm a professor of internal medicine, hematology and medical oncology. I'm head of the comprehensive cancer care at Mavi Med Hospitals in Vienna. And today I'm covering new aspects, modern aspects, in the diagnosis and treatment of cancer. In recent years, there have been important advances in the diagnosis of cancer. This is mainly related to a better understanding that each disease has very important sub-entities. This is defined mainly by advances in what we call molecular diagnosis. So, in the diagnosis of cancer, we not only look into the microscope, but we perform very differentiated analysis to look into genes and their products, and thereby we can define very distinct entities in the various forms of cancer. This is important for the diagnosis and then later on for therapy. A second aspect is the importance of staging. What we mean by staging is to define to which extent cancer is present in the body. And obviously it makes a difference if it's localized or stage 1 in many diseases, or a more advanced stage with involvement of different organs. We call it the metastatic stage. And with modern technology incorporating CT, MRI, and also PET-CT, we are in a very good position to exactly define the stage of the disease. And again, this is very important for defining the therapeutic concept. Modern approaches to the diagnosis of cancer today also utilizes artificial intelligence. There are several examples. For one would be endoscopy supported by artificial intelligence, where areas of the mucosa of the colon are identified that may be suspicious. So use of artificial intelligence really increases the detection rate of early abnormalities found in the colon.
Medizin ist die Artificial Intelligence, die künstliche Intelligenz, gerade in der Endoskopie beim Darmspiegeln extrem wichtig. Wir können mit diesen Hilfsmitteln, das technisch bei den Endoskopen zugeschaltet werden kann, die Polypenentdeckungsrate um 10 bis 12% anheben. Das ist signifikant mehr als mit der herkömmlichen Endoskopie. Warum ist das gerade beim Darm so wichtig? Die Darmspiegelung dient ja als Vorsorge, als Krebsverhütung, und wenn wir mehr Polypen entdecken, können wir mehr Polypen abtreiben und mehr Darmkrebs verhindern. Das heißt also, dass die Anwendung der künstlichen Intelligenz bei der Darmspiegelung zu einer Verringerung der Krebsrate führen wird. Der große Vorteil der künstlichen Intelligenz ist, sie wird nicht müde, sie unterstützt uns und sie ist immer dabei. Der weitere Vorteil ist, wir können auch die sogenannte Polyp-Miss-Rate, es gibt immer einen gewissen Anteil an Polypen, die übersehen werden aus technischen Gründen. Diese Miss-Rate wird um ca. 50% reduziert. Das heißt, wir entdecken mehr Polypen und wir übersehen weniger. Das heißt, wir sind in einer doppelt guten Position, wenn wir das unseren Patienten anbieten können. Dieses künstliche Intelligenzprogramm schaut immer mit und errechnet sich während der Untersuchung, ob eine Schleimhautveränderung ein Polyp sein könnte oder nicht, und zeigt diesen Polypen in einem grünen Kastel an, und der Untersucher weiß genau, aha, hier könnte ein Polyp sein. Die letzte Entscheidung, ob eine Abtragung erfolgt oder eine Probenentnahme, liegt immer beim Untersucher. Das entscheidet nicht der Computer, das entscheidet immer der Arzt.
Treatment of cancer has changed a lot during the past years. based on the precise diagnostic, treatment is now really an individualized approach, and of course needs to incorporate various disciplines in what we call tumor boards to define the optimal treatment strategy in each patient. This means that specialists in surgery, in medical oncology, radiotherapy, and also sometimes in radiology and other disciplines sit together, review all the findings in an individual patient, and then define the optimal treatment approach. As far as medical treatment is concerned, we not only use chemotherapy today. Chemotherapy is just directed against cellular proliferation, cellular division. And this is non-specific because proliferation and cell growth occurs not only in cancer cells, but also in normal cells. Based on the findings that we make during diagnosis of cancer, we can now direct therapy very specifically against the cancer cells, and the normal cells are much less affected compared to the chemotherapy approach. So based on, for example, specific genetic abnormalities and their consequences in the cancer cells, we can use immunotherapy approaches like antibodies. A very important progress made in past years, and the combination of antibody treatment plus chemotherapy is now frequently used in many forms of cancer. There are other modern treatment approaches utilizing these specific abnormalities in cancer cells. We call this class of drugs kinase inhibitors. Again, these are very specific medications. They are available usually as pills, so an oral treatment that is very convenient for the patient. And they need to be taken usually for a longer period, but they suppress cellular growth and survival on a very specific way. And again, it is important that these drugs usually do not affect, or only affect to a low degree, the normal tissues in your body. So modern cancer treatment is characterized by a higher efficacy against the cancer cells, but better tolerability because the normal cells are less affected. And taken together, this is really the progress we have made in the past years, that we can diagnose cancer on an individualized basis and then also design treatment in this way, and thereby cancer can be either cured or made a chronic disease that it is controlled, there are no or only few symptoms, and there is good quality of life for the patient. Surgery is still a very important aspect in the treatment of cancer. However, there has been an important change in the past years from more radical therapy down to less invasive procedures. Other important advances incorporate use of robot-assisted surgery. So the incorporation of Da Vinci as an assistance to modern surgery has greatly improved our ability to treat special forms of cancer, and there is in particular an important indication in urology.
Wir haben ja hier in Döbling jetzt das neueste Da Vinci XI-System gekriegt, wie man hier sieht. Der Da Vinci macht alle komplexen urologischen Operationen, vor allen Dingen im Nierenbereich, Nierenbeckenplastik, Nierentumorexzision, auch die Nierentumorentfernung, rekonstruktive Eingriffe am Harnleiter, die radikale Prostatose. Also überall, wo man minimal invasiv in den Bauch oder ins Becken möchte, bietet der Da Vinci einfach einen Vorteil gegenüber der offenen oder laparoskopischen Technik.
As you have heard in the past minutes, modern treatment of cancer is really complex and needs to incorporate various disciplines and experts. Therefore, we have established our comprehensive cancer care center in Vienna, utilizing all these aspects. And our mission is to provide patients with rapid access to all the specialists needed for complex diagnosis and treatment in an individual case.